If you've been paying attention in the functional medicine space, you do know that there's a very, very strong connection between the health of your gut and your health. So we're talking about the health of your joints, talking about your mood, talking about your weight. So what is this specific connection between your health and your gut health? So what happens in the gut, unfortunately, doesn't stay in the gut. So, studies have shown that certain people with very low levels of a particular bacteria called Akkermensia, they tend to have certain health problems. For example, weight issues, so they become type 2 diabetes, struggle with obesity, just because they've got low levels of this particular bacteria. People that have got like joint pain, so if we check the levels of inflammation, you find that those levels of inflammation are very high, and this is related to low levels of Akkermensia. If you talk about brain health, like mood disorders, but even serious neurodegenerative diseases like Parkinson's, those people have got low levels of Akkermensia. And so Akkermensia can decline with age. It can also decline if a person is eating a very poor diet. So in other words, a diet that has got very high inflammatory fats and very little fiber. So there is a lot of things that you can do to improve the levels of Akkermensia. But the one thing is that sometimes it's very helpful not to just guess but test. So we use a certain test called the GI map. In this test, we will see all the different types of bacteria, inflammation levels, if people are intolerant to gluten, if there is a risk of getting, cancer of the colon. So this is a test that you can test, and we can actually ascertain if you've got adequate levels of Akkermensia, and then you can then inform your treatment plan. Because sometimes, when you just think I've got gut issues, but you don't really know what to do, that's when testing is very, very important.